to order with everyone present. First item on the agenda, Krista Vandenbrink, Public Health Director, with an update. Yep, you can grab a chair. Like you've been practicing on yourself.
Floor one. Let's put it that way, right? Floor one. Okay. So in public health, we're busy. Okay, it's flu shot time, and so we're getting questions about, well, are you still doing flu shots? Yes, we are. They are by appointment. Okay, so people just need to give our office a call. We have a great system now in which we're able to collect all of your insurance information right away, and when you come in, if there's a copay, we're able to collect that immediately. The good thing is we not only do flu shots, but we also are offering RSV for adults. We are also offering Shingrix, so that's the shingle shot for adults. We're waiting on our COVID vaccine. We've been asking, and that should maybe be in this week. We also have the pneumonia shot, or the Prevnar 20. That's a vaccine for adults. So that's with our new system called VaxCare. So my vaccine storage units are full of vaccine that we are giving. We've had a couple of clinics already, and we've done some off-site clinics. Those have been very successful with our new system by collecting that insurance. So they do all the billing for us, so it's saving us a little bit of time on our end in being able to try to recoup the billing process. So that's a huge thing for us. The state also has launched a couple of new programs. There is now a flu vaccine for dairy workers, and they are doing this in relation to the avian influenza that was affecting the birds and has been transferred over to some of the dairy cattle. We have a list of the dairy farms here in Winneshiek County that has been provided to us by the state, and so we will be contacting them to set up times to provide immunizations to those workers. So new program, new money with all of that. There's also a vaccines for adults program run similarly as our vaccines for children program. So we'll be able to offer vaccines for adults provided they meet income eligibility guidelines, and that will include all kinds of shots. So like the tetanus shot, the Gardasil shot is a big thing for women. Cervical cancer, okay. So we have to follow certain guidelines for that. So new program with all that, all positive things. So once again, our vaccine storage units are full. We've been contacting the free clinic to find out what kind of vaccines are they maybe seeing some of their constituents that are coming into the free clinic that maybe they need, because usually they take care of adults, and I'm still waiting to hear a response back from them, but we have reached out with some of our different partners to at least let them know. And so positive things all on that front. So any question?
What, measles? Is that
Measles. What's happening with measles? Well, measles is still dancing around the country and the world. Okay, we don't know if or when we'll ever get a case. We certainly hope not. Right? We are doing immunization audits now. That happens in the schools now through the end of October, and then we start with the preschools and daycares and do their immunization audits. And so taking a look at, are we having individuals who are having a medical exemption or a religious exemption for certain vaccines? So I don't know what those numbers truly look like. We're still in the throes of it. So once I have all of the immunization audits done, then I'll have a better idea of, are we seeing an increase in those numbers or we're staying the same, right? So we know that because of some challenges with COVID, nationwide, there's been an increase in some people who have been delaying some of their vaccinations, okay? And some of that has been measles or the MMR vaccine, and some has just been other vaccinations. So I'm taking a little tally as far as which vaccinations I'm seeing being lagged. And so far, I've not seen that with the measles.
This is what the Twin Cities had.
Twin Cities had an outbreak, and the Twin Cities and Des Moines, of course, that is a thoroughfare, and they actually have groups of the same people who, one group, I don't remember which group it was, I think it was the Des Moines group, they were okay with the MMR vaccine, and Twin Cities weren't, okay? And so what happened was there was education with those public health departments on both ends, and they were able to kind of meet in the middle and make sure that those family members were getting the same education. So we were able to turn the page for some of those people who were not wanting those vaccinations. So that's a positive thing, okay? So things like that do happen, right? So knock on wood, we don't have measles here in the county. Providers have been told to continue to look for it. There's lots of other diseases that they're also being told to look for. I mean, there's, you name it, and it's out there in the world right now. So as far as other services that's happening, we had a meeting with the Iowa Department of Health and Human Services here on Friday morning, I guess it was. And Dr. Ken Sharp was here, and Dr. Robert Cruz were here from the state, and we had several public health officials, as well as Mike Bergen and Tricia Wilkins from Northeast Iowa Community Action were present. We were able to hear the conversation coming from the state, indicating that, you know, public health is still very much of a needed resource. Public health will still remain in all of the counties. There will be some collaborative approaches when it comes to contract administration, but the services still are going to be existing in all of the counties. The thing that will upset the supervisors the most is that here in a couple of years, any home health clients that are being billed to the local public health services contract, that's going to be on the county for that hook. And so agencies are going to have to take a look at what is their pay source. Okay, so there are some of these people who don't have money to pay for any type of home visits. They can't meet the private pay visits that happen in and from another entity, another home health entity, and they don't qualify for Title 19, so they make just too much money. And so what does that look like? And so there's going to be some challenges when that comes out, and so agencies are starting to really take a look at this. For instance, our agency took a look at things and we made adjustments, taking a look at the federal poverty guidelines. We still have a handful of people, they make too much money for Title 19 and they don't have the $200 some odd dollars to pay for a home health visit from another home health agency. And so we have them on a sliding fee scale. Right now they're at the 0. So they're not paying anything. We are billing that time, those visits to the local public health services contract, but in a couple of years, that has to go away and all of our time will be spent on public health funds. So public health activities, population health activities. So we'll have to figure out what we're going to do with those individuals that can't just evaporate and go away. They still need services. And so that's where, as things are written in code, the county is the funder of last resort. Right now, there's about 5 of them. Okay. And so some of these people are just every 2-week individuals. Some people are every week. Depends on what is happening with their caseload and what's happening with their current health status. So, but yes, public health is still very much needed. It's not going away. Lots of people think that public health should go away. It's not. We are still strong. Still need to be in existence. There's so much public health activity happening that nobody's had the time to be able to do. And so we're also hoping that there will be some increased funding because we'll be able to focus more on those population health type services. The other thing is, okay, what's happening with our building, right? So that is something that our board will be working with, talking with Tricia Wilkins a little bit more to find out what are our options for possibly staying where we're at. We know that you guys signed the lease to keep us there. The shortfalls of the community services building is that it's costly to put additional drains in for sinks, for washing equipment, from loan closet, from having additional clinic sites basically. So for instance, on Wednesday, we had 2 clinic rooms that were being used at the same time. One was being done for flu and the other, there was a confidential test that I needed to do with that individual and have a very confidential conversation. That could not have happened in the same space. Okay, so having those separate spots. So we know that there's limits to that community services building and being able to have separate hand washing sites. That would have been really nice to have had, already in existence. So right now, yeah, we're making things work because we know our space. Okay, and so for now, it's probably best for us to kind of hang out where we're hanging out. We're trying to collapse a few rooms because we don't necessarily need all of that space, but that's something that's taking us a little bit of time because we are dealing with a lot of other changes that are just existing at this time too. So new seasons for us, things that we just kind of need to figure out on our own.
Two questions I've been asked so often are, what does home health care visits look like going into the future right now with you? With your staff?
Yep, great question. So that's something that we're trying to explore. So if somebody has Medicare or if they have insurance or Medicaid, we can't accept them as a home health patient. So they have to be a private paying individual. So that's part of the whole decertification process, in that we said we weren't going to be billing Medicare or Medicaid or any of those insurances specifically for home health. So we still have a nurse who can do nursing visits for people. We have a home care aide who can go out and provide personal cares, so baths for those individuals. And we also have a homemaker who can go out and provide basic homemaking services. So helping to vacuum, helping to pick up groceries for individuals, cleaning up kitchens, cleaning up bathrooms because it's a danger for somebody else or they can't move the vacuum cleaner. So those are the services that we're able to offer. It is best for them to give us a call and we can walk through what kind of services are they thinking that they're after. And if it's something that we can't offer, we can at least go ahead and provide some referrals, give them some other resources for where they can get services.
Are there enough other resources in your area?
Limited resources. Mhm.
And then the second question I often get is the foot clinic.
Currently, our foot clinic is still going. We've had some individuals who don't necessarily think that foot clinic is important. However, our Board of Health has said it is very important. This is definitely a population health type of service where we are able to take a look at a person's feet and help them identify if they're having some problems where they actually need to go to a podiatrist. We have a lot of individuals who can't get their toes to their nose. Okay, and that's not just the elderly. Okay, that is younger people that they cannot get it there. Yeah, can you do that? Let's go ahead and try. Okay, and so they need some assistance going ahead and clipping their toenails. And so it's open to all ages. And so we have diabetics who come in. We have individuals like you and I who come in. They want somebody to go ahead and trim their toenails because if they do it, they're going to end up with problems. They're going to take part of their skin or lots of other issues that happen. So that is continuing, yeah. So, the government actually made some changes to who is allowed to go to a podiatrist and when. Okay, that was federal government, it wasn't me, right? So people who have Medicare, you can go to a podiatrist if you are diabetic and if you have known foot problems. You can go to your doctor and have them trim the toenails, but that is a non-Medicare covered service. And so you're going to pay out of pocket for that. And so people just privately pay to come and get their toenails trimmed with us. So yes, things are still continuing. There's lots of changes. This is, like I said, a new season for us, a new year for us. So we're trying to figure things out kind of as we go too. So it's kind of building the airplane as we're flying it.
How many staff are currently there?
6.
Six.
Did you just hire somebody?
We did. We did, yep. Mhm.
Previously, when we owned the building, the county was doing the cleaning and maintenance in there. Who's doing it now? Floor.
Yep, so, even when the county
Mark
did.
just asked my question.
We did our own cleaning. Okay, so we were having to clean the bathrooms, we were having to do our own vacuuming and mopping the floors. That wasn't being done. Maintenance was taking care of the garbage and taking care of the cardboard. So we have worked with Community Action and we just let them know when things need to be addressed. So we had some light bulbs that were burnt out and we let them know. We just said, hey, we know that this is a transition for you. Just let us know how you want us to proceed. And so they took care of things. As far as cardboard, they've told us when we're supposed to have the cardboard downstairs, where that's all going to be taken care of. So it's a transition for them too. So there's some things that they hadn't thought about that were maybe some issues that we've brought up. But we're working through it together and we're good partners.
So cleaning basically is the same as it always has been.
We're having to do that at this point in time. That's just another thing that we have to take a look at. Mhm.
Yeah. With the DHS building, do we do cleaning out there? I don't know. They do their own.
I don't know if they do it or they contract with someone to do it.
I don't know.
But we don't do it.
I think I see a contract bill coming through. There is a person that,
Yeah.
that comes through. I think I see on the payables.
I'm sorry. So we're paying somebody to clean it then.
I don't, you could look it up on the claims. I guess.
Well, yeah, I can do some checking. I'm assuming if we are, it's not an employee, it's a contract employee.
I see a contract comes through each month.
Yeah, to see it, yeah.
Yeah, the only thing we do out there is unusual things that need to be repaired, whichever is what I understand from.
Yeah. John Halverson does go in with the boilers acting up or something like that, but.
Does anyone have anything else for Krista?
So you said you are trying to retract on space wise, so you don't need to rent all of that space.
Yeah, we're taking a look at some of those things. And it just takes time. And so trying to figure out, okay, well, do we still need this space? We actually know of an individual, and I've let Tricia know. There is somebody who is interested in some space up on the floor with us. We already work with that person, but that's not for me to make that decision. And so I have to have a further conversation with those individuals and connect those two people together. So, yeah. Mhm. Yeah.
Thank you.
Okay.
Oh, you're welcome.
Thanks, Krista. We are next up, Jayne Schultz, our county recorder. It's like we've changed the rates a little bit.
We're gonna try, we're gonna go for it, and so, so I just thought I'd make myself available if you had any questions regarding the information that was sent to you from Iowa Library. And if you want me to go through, what a recording fee is, anytime.
What are the changes? I mean, how much is the increase?
So currently, the recording fees are $7 for the first page, $5 for every additional page. And the $7 splits out $5 to general fund, $1 to e-commerce, which helps fund Iowa Land Records, and $1 to really the Recorder's Management Fund, which is kept by the Recorder's Office itself. And so that the proposed modernization fee will be $10 flat for each page. And that first page will split $3 to Iowa Land Records, e-commerce, and $2 to the Record Management Fund. And we're going to try to change that, broaden our ability to our ability to use that fund. Right now it's well, of course, everything we do is through Iowa code. So we have just like 4 different ways we could use that records management fund. An example would be, if our scanner went down, we could purchase a new scanner with that fee. Preserve and maintain public records, assist counties in reducing record preservation costs, and encourage and foster maximum access to public records, and establish plans for anticipated and possible future needs. So that's kind of vague, but we're trying to broaden to include like training for records management for the staff and not reporters themselves. So
Like the ARCA search that we.
exactly, that would preserve.
Scanned a bunch of records using
Yeah.
ARPA money, they can pay the annual maintenance fee out of there.
Exactly, yeah.
So you said that $10 was for the first page. What about?
$10 would be flat for every single page. So
Let's
it'd
make a
be-
division of funds then.
So that first page would actually, $5 would go to general fund, and then each $10 would go to the county general fund. Because $5, $3 goes to the records management, $2 goes to e-commerce.
After that, the $10 goes to the county for each page.
Yeah.
Moneymaker.
Yeah, it helps our office to be self-funding.
When was the last time the rates were changed?
1984, I'm glad you asked me that. Actually, July of 1984, so 40 years.
So that,
Yeah.
those funds could go for wages then too?
No, it would not.
Well,
I
the
guess it
general
would be-
fund money
Yeah.
is indirectly
Sure,
going to
yeah.
wages, yes.
Yeah, but.
For the first 5, but then after that, nothing.
Well, the 10,
The $10.
$10 goes to the county general.
so it's all general
Yeah.
fund.
Yeah.
So pays for wages.
Yeah, everything, it goes to general fund, and that's our.
What's a typical, look how many pages did somebody typically?
Well, yeah, so if you saw, they, kind of made some estimates across the county. 4-page average and they thought about 4.5-page average. And I looked, so you get my report every month. So, so this is I did a few averages. So for September, it averaged about $5, 5 pages per document. So the greater the amount of pages, the more the county goes to the general fund. And last month was 4.82, and back in April, 4.5 pages. So that's a pretty good estimate. And so at 5 pages per document, 45 is what I estimated increase. So total $10,620 for this past month, which is an increase of 45. If we had had this in. And of course, with, if interest rates drop again, there's going to be new mortgages taken out. The last month, 65, 63. So you get this is my monthly report that you get, 61. So we average about 60 plus mortgages a month here in our county.
And you receive very many digital records, or is it all come paper?
So, but the fees are the same.
Right.
Yeah, so,
If it comes digital, you still print it out and record it.
well, we are able, the only way we can accept a digital, real estate transaction is through Iowa Land Records. That's our platform to accept digital documents. And yeah, we've seen a general increase, but we still have some local banks that are very busy, and they still come up to our office every day or every other day.
To bring you
So,
paper.
yeah. And when we first started, well, because there is a $3 fee, and that which also helps fund you submit a document electronically. But you save that postage, you save
The runner.
time.
Time.
Yeah, yeah. you can
Bring it to you every
Yeah,
day.
yeah, when, so Iowa Records started back in 2005, and I didn't really foresee people that were across the street utilizing the e-submission service, but they do, now that people are working from home, maybe they're the only person in the office, and they can just send it electronically, and they have the recording information immediately, so it's a big time saver for both of us, really. So there's a big advantage that I didn't foresee, and, he's willing to try, to move the office forward in technological ways. And so it wasn't that I was against it. I just didn't see, well, people, right, we have so many in-town local customers, that I didn't foresee it being used by them as much as it has been. So it's been a big success. And a lot of recorders back in 2020, had to figure out how to accept documents digitally, on their own. And we already had this platform. So it wasn't something I had to worry about. It was already there, which was really nice. And there's very few systems that are statewide. So that's a big advantage too. So that if you submit a document in Clayton County, Polk County, you do it in the same platform, the same way as you do it for here in Winneshiek County. And all those records are available. So if you're doing title search, you can, in one platform, see all those, all the transactions. So it's a really big asset for the whole state, anybody in the recording industry, real estate industry.
Do we have all of our records, the old records now digitized? Are we still lacking in some?
I have to admit, there was a few books I missed. We have so many books available. I thought I had everything up to 1930, and there was a few miscellaneous that are pretty old. Some that I missed, maybe about 5 that were sitting on another shelf. But they're pretty well organized, but then there's these odd, over the years, they decided to parse out different types of documents for whatever, I suppose to their advantage, however they were, whatever the recorder was or whatever, but these were a little bit, like all the sheriff's deeds were in one book instead of just all the deeds in one book or that type of thing. So it was, so there's a few that I didn't have. And we also have these, we call them range books. 7, 8, 9, 10 is the ranges in Winneshiek County. And Jim Morey of County Binders is coming into our last bound range book. He's going to come in, and what he does is rebind it so it's loose leaf and can be scanned. And the other 4 have been scanned. So that should happen this week. So, yeah, it sure is. Yeah. So.
What the book of everything or whatever, the
Yeah,
book of one.
Yeah.
Been digitized.
Yeah.
Where's is the original?
The original's still in the clerk of court's office. No, but they were not willing to surrender the document permanently, but they did allow us to take it and have it scanned. So
Get the convention, those companies that do that.
Yeah.
That's good.
Overall, that's a pretty modest increase if it hadn't
Yeah.
changed since 1984.
Yeah. So rating it would be a lot higher. And plus, as you saw from the chart, Iowa recording fees are lower than our neighbors. And, so could it be good for the county? Good for, So we just hope to have you out on board, and I don't, as far as the public, of course, anytime you raise a cost, it always ends up with the consumer. But, most people spend a lot of money on recording fees. If you refinance, if you look at the breakdown, of what you spend to refinance recording fees are pretty small.
Does anyone have anything else for Jayne?
Thanks.
Thank you for your time.
I like to call it modernization.
Yeah, well, because those, we want Iowa land records to be more than what it is now. So we're hoping to increase the value. One of the things, which I don't have a lot of information on yet, is the fraud prevention, fraud notifications that will be going through Iowa land records. So I don't have a lot of information, but I think it's going to be a mandate by 2025. So I have to
Just
figure
to
that
talk
out.
about fraud in land records, fraud prevention.
Title fraud.
Yes, exactly, yeah. Which actually, I don't want to worry everybody because Iowa is a very safe state because we're one of the few abstract states. So I think it's not as prevalent in Iowa as it is in places where you just buy mortgage insurance. It's going to be more common. So, but it would still be, one more level of security.
Good.
All right.
Thanks, Jayne.
Thank you.
Thank you.
Next on the agenda, Mike Kueny, county engineer with the road projects updates. Good morning, Mike.
Good morning. This is the fuel contract. Yeah, I can sign that. From last week's vote.
Great.
So just run through the report that I sent. Bridge 5 for the approaches to be paved is occurring this week. Completion for the project opening will likely be first half of November. Bridge 208E check plans are being prepared to submittal. Then on W14 million operations for headers in Fort Atkinson and Spillville will be done today, and headers in Ridgeway will be done either today or tomorrow, depending on how late they can work. Paving operations with one crew will follow for the rest of the week. We are trying to determine how many crews will be on here. 2 crews is likely, and possibly 3 crews is still in a possibility. Press and viewers are welcome to request being on this list by emailing engineer@co.winneshiek.ia.us. The speed study, no work was done this week. Subdivision, no work was done this week. Striping operation is being discussed with Farner, perhaps later in this week. I have not heard anything new, so that might be pushed off again until next week. Upcoming union negotiations, I haven't heard anything, so I'll say if you hear anything, let me know if I should become aware of something. FEMA, it's mostly the same. We are going to have a meeting for the category A claims, which is the flood debris underneath the bridges. That will happen next week. We're looking for $34,000 in claims. And that's to start out with. We don't know how long it's going to take to finish the disposal, but the $34,000 is the initial estimate. Estimates and quotes for Ridgeway shop improvements have been received. Mark, did you receive the quotes that we took on that?
No, I haven't.
Okay, it's because they were sent to your email. So look in your email.
Maybe I'll look. Yeah, I guess I didn't notice if they were.
Yeah, and they were sent in your email, I think, through Jeff, Jeff's. Dear, That's the same as last week. Not heard back on the SS4A. I'll be looking to touch base with them again this week. I spent a lot of time this week working on truck specifications for our fleet, truck country in particular. I can kind of go into the discussions on that, but it goes into the weeds on things on trucks. Talk to me if you'd like to about where we went on that. Working with Chuck Britson perhaps to rate our railcar bridges in the county. Had a discussion on Friday on that. I went to Clinton County on Tuesday to observe the installation of base stabilization on a shoulder project. We used base 1 as a base stabilization agent, and then I went and visited another location for a Parmesan. These are the 2 primary base stabilization products that I'm looking into using next year as a test case, very similar to what Clinton County is doing, and a couple other counties are looking into this pretty heavily as well. At the end of the week, staff attended ICEOO annual conference in Des Moines. And then this week, Hacker Nelson will begin its audit. Not sure if they're going to start with the secondary roads or where they're going to go. So it's my first one. That is
They have a whole team. You'll probably have at least one person that is set up shop in the engineer's office.
That's right behind mine.
Yeah.
What I've heard.
Yeah.
So, with that, any questions?
We set a minimum temperature when we no longer can stripe, when we run the striping operations.
I asked the same question to Mike if he knew off the top of his head, and he said, because I said, is it 40 like it is with asphalt? And he said, that's what I remember. So not confirmed.
It was 40, 50.
But long-term weather outlook is good. So, and the longer we wait, the more solid that they'll be able to paint on. So, the other thing on that is we plan on having a significant striping operation next year. So, the striping it's important, but it will be, it'll hold up good enough to last a year on this pavement that's not quite all the way set in yet.
What's the plans for striping on W14?
It's got to get done first.
I get that part.
How long? Well, you know, if they move in with 3 crews,
I don't know if they will. That's
even 2 crews would.
well, the idea there is the 2 crews. You'll have one on the north side, one on the south side, and then you'll have the pave outs, which would be the 3rd crew. But that's guessing, and that's not been told to us. So we're just thinking that River City is wanting to get done just like we are.
Yeah.
So every indication is that they're pushing. So
Is their plant moved in out there on B16?
yeah, the Sticka, yes, they're setting up asphalt plant over there in the Sticka quarry. So they sent that permitting in middle of last week. So
the B32 and that 227th Avenue, that's there between 4.
that's the motorcycle.
Yeah.
And then it's on that SS4A. I sent an email, didn't get a reply back, just on it's a nationwide grant process that Iowa's engineers have allocated time and effort towards getting grant funds. I don't know all the ins and outs of it, but I have been assured numerous times that they will work with me on which projects we work on. So that's
Next spring.
again,
I know I had a text last week, somebody.
if I can get federal funds to do it, I mean, it's on my short list. It's their #1 priority on that list is the Madison Road
last week.
Highway 52.
Another record there.
So that's number one. There's number two is, so that, those are two excellent,
Yeah.
um, directions for federal funds to go. And if federal funds don't go that way, we will be looking to do something locally on it.
Yeah.
But I want to find out what they're gonna do first,
Yeah.
so.
Is there a DOT meeting in town?
There was this past week, I couldn't go.
There's
So,
not one tomorrow.
I don't know, so someone had told me that it was last week, I have not committed to any of those DOT meetings, and I've not been told that I need to go to them. It's not that I don't want to go, it's just, it's a factor of schedule, yes. But again, I can look back at my emails, if I look back at my email, if I can forward you the email that I have on.
If it's tomorrow, if you could just let us know. I don't remember getting anything about it.
And someone was asking about it as if it was late in the week last week. I can't remember who that was. And I had asked somebody a long time ago if this was a requirement for me, and they said no. And, you know, I was gone all weekend and I didn't want to overextend myself.
Yeah. On the speed study, it says data collection is finished, report's been started.
Yep.
Do you think we'll get a report in 2 weeks?
I need to put that as a priority. I've been trying to keep these projects going and keeping eye on next year. And unfortunately, that's caused me to put that on the back burner. You put pressure on me makes it.
I don't mean to put pressure on you because I know there's way bigger projects we need to be addressing.
Well, I got started on.
Take this off of here for now and address this later.
I would like to keep it on there to keep me, this is kind of this helps me. This isn't just for you guys. It's a keep me honest and keep me on the follow through type of a list. So, and so I'm perfectly fine with that. And, yeah. Full transparency. So again,
You want to consider pushing off the subdivision study work past at least past the FEMA work that's taking a lot of your staff time.
yeah, and one of the things, you know, you think, oh, I have some time this past week to get the speed study worked on, so that way I can move on to the subdivision study. And then, I mean, I spent probably 4 hours with truck country this week with dealing with the trucks. So, you know, that's one of those things where I'm trying to make sure that the bids that we get on Friday for these trucks are as fair as possible and address all of their concerns. But that's just one of those things where, you know, the truck became all of a sudden an important thing, and I had on my radar doing it later, but it came up to be more important. Mostly due to the fact that the Allison transmissions that we want in our trucks are extremely hard to get. So
What's actually pushing that bridge final back to?
they're working. I mean, they started, when I say late, not officially late, they just started later in their allowed time, and their scheduling, their schedule allows for this, so they're at the end of their schedule. They have 25 working days left as of today, so that's, yeah, in the contract, so they're on time. But there's a lot of approach paving on this project, so it's a little bit more than you might think, but
This is got bridge by Austin.
yes, north of Castelia.
Yeah.
So, yeah,
Does look good.
I haven't been out there in a couple weeks, so, but all hands are on deck for W14 and make that project go.
Yeah.
So,
Yeah.
Is there any word on when they're going to start a concrete work down there?
on
W14 at Ford.
Today.
concrete work, no, they're gonna be milling and trying to set up those headers for, the asphalt work, but the actual pour on the concrete. I mean, that would be, I don't know what to tell you. It'd probably be sometime this week, if they can get that done.
And then their interaction with the railroad on that railroad crossing.
That's a detail that I had not heard about. I know that that's been a concern of a lot of people's, and again, I haven't talked about that with anybody for a month or so don't know what to tell you on that. Do you want me to look into that further, or?
I'm just curious to see, because it's lagging, but I'm sure they're aware of it.
There's multiple things lagging, and they have some potholes that they haven't filled all summer. So yes, the railroad is on my mind, more than it should be.
Yeah, a lot of positives on the W14, how nice is the rewrite.
Yeah, it needs to get covered though. It's
It's busted up.
the cold in place is not designed to take
A lot of.
a lot of water and moisture in, so it needs to get covered. So
That it's
It's a good year
considered.
for that, because we ain't had no, should be to do it, you know.
yes, it's been a fantastic construction year.
For that. So hopefully,
It's locally considered the new freeway in Winneshiek County.
yes. Yeah,
Unfortunately,
just.
That's not a
Good say.
that SS4A might, we've been doing a good job shouldering, but it might,
Does.
if they get higher speeds, that's gonna be a concern.
We don't have anything else for Mike? Thank you, Mike. Thank you. Next on the agenda, we have a few miscellaneous items, first of which is action on Midwest Group Benefits Flex renewal.
So yeah, when we contract with Midwest Group Benefits for providing the flex benefits accounts for employees, and it's just up for annual renewal. There's no change in the fees. Same fees as last year. It's $25 per month per employee if it's 5 or fewer participants, or $50 per month. Actually, no, it's $25 per month total if we have 5 or fewer, $50 per month if we have 6 to 10, and then $4 per participant if it's more than 10.
I would move to approve the Midwest Group Benefits Flex renewal.
Second.
We have a motion and a second to approve the Midwest Group Benefits Flex renewal. Is there any further discussion? If none, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries unanimous. Next up, we have action on the 2024 Weed Commissioner report.
Doug prepared this, so it's the report as outlines the weed complaints and responses and money spent on chemicals and so on that he does as the weed commissioner.
You got any comments on it, Doug? Or?
I don't, it's pretty much status quo from last year.
Okay. Anyone like to take?
I'd move to approve.
We have a motion and a second to approve the 2024 Weed Commissioner report. All those in favor, say aye.
Aye.
I just have a quick question before we vote. Is this something that could be emailed out ahead of time to all of us?
Sure, if you want it once a year to come to you.
That'd be great. I just haven't had a chance to read through it.
Make much sense to you because it's all pretty much what's in the office there, all the numbers and things like that. But you want the final report emailed to you ahead of time?
Yeah,
Yeah, you can do that. Yes.
scan it.
Yeah, I thought you meant before it was filled out.
No, just,
Yeah.
it's just weird to vote on something I've never seen before.
Sure. Yeah.
All those in favor, say aye.
Aye.
Those opposed, same sign. Motion carries unanimously. Next, discuss and act on at Wellington Place. I asked Doug to come sit in on this so he can give us a little insight. The money's available for it and process.
So Dan called me last week about an abandoned well at Wellington Place. And there is an abandoned well behind Wellington Place. It's a 5-inch steel casing. It's got a
Franklin motor control head on it, so it probably has the pump and the drop pipe still in there with the pipus adapters. Well's not being used, there's no power going to it, the switch is off to it. My guess is the original farmhouse that was back there at one time, that probably fed the whole farm. So we do have grant money available that would pay up to $700 on plugging the abandoned well. You decide to do that. So I think it'd be a good idea to plug it to protect the groundwater that's not being used. So if that's done, they would cut the casing off, and when they leave there, it'd just be, that's right over that spot.
How deep is that well?
I don't know how deep it is, you know, being that the river's right there.
I would guess one of the, that 100
Shallow, yes.
120 well.
No, and no, it wouldn't be worth having as a standby well. There's holes up in the casing where they bought the electricity through there. And a new well, that all comes underground and comes back up. So it's something that needs to be plugged. It makes no sense to keep it.
Do you coordinate that for the board to?
So I can, I mean, how that works is it has to be plugged by a certified contractor. And they send me the DNR plugging sheet and an invoice on that, and I submit that back to the DNR for reimbursement.
And we do have $5,000 for just general maintenance items at Wellington. So if it goes over the 700, we do have money available for doing that.
So if you want, I could call, there's two contractors that do the lion's share of that. I could call them and say, hey, can you give me an estimate on it?
Great.
They usually come out and they'll drop a line down there to get an idea how deep it is. And it depends how much bentonite cement it's going to take to plug it up. So.
Yeah, if you would want to do that, that'd be great.
We can do that.
Yeah, I'd move to go ahead with that.
I'll second that.
We have a motion and a second to act at the Wellington Place wells to be capped. Is there any further discussion?
We're giving Doug authority to go ahead with it without any further approval.
Right.
So just go ahead and do the job. So, okay.
All those in favor, say aye.
Aye.
Those opposed, same sign. Motion carries unanimous. Thanks, Doug.
You bet.
Thank you.
Discuss act on staffing at recycling center.
This was added by the Mark Baldwin as the team that you've assigned to oversee things up there.
But we need to bring in another full-time employee out there. They're really stretched with the number of employees that they have. And so we need to advertise and fill for that position.
They're down 3, basically, and there's a lot to do. And we're falling behind, so.
As you're talking about adding a regular line worker, a floor worker.
Full-time.
There are, just so everyone knows, there are, I think, 3 apps we have so far for the supervisory position too, that you'll have to, you left it as open-ended as far as when. So at any point when you want to start looking, you can do that too, but this is an addition to that.
I think we need to get it going, so we have, whether we hire it or we hire a new person, they'd have a pool to pick from immediately.
We definitely, we're falling behind. That hurts us on workplace safety and cleanliness and so forth. So it really is a pressing issue.
More to the point where there could be other retirements down there too, correct?
Potentially.
Potentially, yes.
Oh, is there a job description for the?
Yeah.
I don't know that it needs to be updated or not, but
Let's go up afterwards. You and I just review with what we
we want
got.
to send it to Steve and I. If anyone else wants to look at it, that's fine too. I want to send it all over.
Does anyone want to take action on this?
Move that we advertise for this position.
Second.
We have a motion and a second to advertise for staffing position at the recycling center. Is there any further discussion? If none, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries unanimously. Next up, action on compensation board. I spoke with Fayette County. They have done nothing yet. But the way it sounds, they are not gonna reinstate the compensation.
And Alameda County is, or has.
I think they have.
They have.
I'm still in favor of having a comp board because it just opens us up. Again, I go back to transparency and community involvement. It costs us nothing to have this board. And it's a way to involve our community in county governance.
I too would be an advocate of keeping it, or I guess reinstating it at this point in time. Because I think it's just that the public decide what these positions are worth. And it's been working, so I don't know why we would go away from it and take it on ourselves.
I would actually make a motion to reinstate the compensation board for Winneshiek County at this time.
Here's a resolution, so if you want to make a motion to adopt that resolution. Sample one that I fact.
Yeah, I'm basically against it. I think when the legislature made this move, there was enough issues that we may not be aware of all of them, that I don't believe that we need to rush into this. We can always add it if we find that we need to do it later.
Or we can take it away next time around too, so I would second that motion. Shirley's motion.
The part that I just don't like about it is the part where you have to reduce everybody by the same percentage. And that's what makes it so unfair. Kind of torn on this one.
The good news is, I mean, it's a year-to-year thing, so. If we find that other counties are having better success with it, I think, like I said, my preference is to continue using it because it's good citizens making the good decisions.
So my opinion is that even if we could make, I mean, the board should be able to make the decision too on what, who and what, not the same. Make them all the same cut. If some people are doing a better job, they deserve to get paid. I mean, yeah. It's a flat cut on everybody or whatever. There's, you're pretty well cut and dry on what you can do. So I'd be against it, keeping it, my opinion.
I'm truly torn on this one.
I mean, if we could make, you know, we could make final adjustments the board can, I mean, that's just a recommendation by them and we can't.
That's
We
still,
adjust one, we gotta adjust them all.
Well, I mean, I think the public with elected officials can make the choice as to whether somebody's doing their job or not, and that's where they vote.
all about.
Well, I was just thinking of something else. If we continue this till next week, give me some more time to think about this. Because I really don't know which way the fence I am on this.
I'm comfortable tabling it till next Monday.
That being good.
You want to withdraw your motion and
I withdraw my motion.
I'll second that.
Okay, we'll table it. Because there's no going back if I vote against it. If you see my point.
Is a week enough time for you?
I think so.
Okay.
I'll make a point to think about it long and hard this week.
See a week.
Oh. All right, 10:30. Next item on the agenda, Andy Vandenbrink, our county attorney. Some legal questions regarding the agenda and other issues. Morning, Andy.
Good morning. What do you have for me? deafening silence. That's what we have. That was great.
I do have a question that came up last week with the P&Z issue. Did you do any research into that at all to see what is our obligation for publishing when there are openings that are terms that are coming? Okay. Again, questions that I've gotten from the community over the last week. So.
Well, Andy was working on the food pantry lease agreement. Got a rough draft of that.
You've got a draft of that. I think Toys Go Round has a draft. I think we have a signed lease now with Spectrum.
Oh, my color coding, I got it right.
Yeah.
Right color in the right offices.
I really appreciate a color coded sheet because I'm colorblind. I can't tell the difference. Thanks for marking them by number too.
Yeah.
Ben sent an email out to John. I think copied you guys on it too for recording meetings. I've started working on kind of a policy type thing that I can advance a little further after I visit with John and find out what he sees as options for doing the recording, maintaining it. I don't know if he's thinking a YouTube channel, which seems to be kind of the common method of doing it. But maybe he and Ben and I can kind of pull that stuff together and get it to you and see if you see any changes that need to be done to the package we present.
I think one of the main things for the community is access as quickly as possible after each Monday meeting.
Well, that's where I think the YouTube channel is probably the most likely one to do that. If we're uploading to a different software package, again, this is more John's area than mine, but looking at other city owners that are doing this, you're more likely going to find them in YouTube than anywhere else. Plus, your storage is pretty much unlimited.
And that will cover all the legalities or storage.
We're gonna have to deal with some of that, but we want to be able to say this is our official version. But for publication, for the public access, so we don't have to say, okay, yeah, here's the link to download it for everybody who wants to watch it. We want it out there somewhere that they can just pick up on it.
I think it's important to remember that there's two parts of the issue. I mean, the one is the making it available for the public, which is what you're talking about now. But the other part is it being a public record and how we're going to maintain it and have it. And if our legal team needs to review the video, we want it to be this official record, not just.
Don't go to YouTube, but here's a link to the SharePoint folder that is being stored in-house. So, right, there's two parts to it.
Is there a limitation we can put on how long we have to keep it, or is it out there?
I think we could put that it'll be retained for say a minimum of 24 months or something like that. Or longer if there's pending litigation involving an issue on one of the recordings. The YouTube channel will not be your official place, but that's going to be there indefinitely.
Yeah.
So if we have the stored version, and that has an impact on, storage space and cost and all of that, I think that's probably one we need to set a minimum time limit. If you get to the end of 2 years and the NAS isn't filled up, or you've got room on your SharePoint site, you may not want to have somebody take the time to start pulling them out. When it gets closer to being full, somebody's going to have to go through and make that extra space.
And just so the public knows, when you post it to YouTube, nobody can edit that on YouTube of your posting. So it is in the entirety and not editable.
View only.
Do we have anything else?
I haven't heard any more from the farm lease, the
Oh,
the estate of the renter. I mean, Andy prepared that document, the updated lease and sent it to him, and we haven't heard anything back. So we haven't acted on that yet.
My understanding is there are some things happening within the estate that might slow that down.
Okay.
And quite honestly, if they plan on moving forward, the name is probably not that material. It's still a binding lease and the estate is bound by it, even if we don't change. the
Although
name of
didn't
the
they
tenant.
give us an official notice at one point that they were,
They gave us a notice that it's not, in my opinion, it's not effective.
okay.
it's just, they had the legality issues, they had to send it out to get, or.
They don't,
They didn't have, yeah, I don't know.
if I'm leasing Mark Farm Ground for 3 years and in year 2, he sends me a notice of termination. The notice isn't effective if it's a 3-year lease, and that's my take on that notice as well. And that was their decision to move forward with continuing with it. So it'd be nice to get it squared away so we know where the check's coming from and all that, but it's probably not critical.
They gotta take it from his to the estate or whatever,
Right.
is what it amounts to.
Anything else?
My understanding was they're hoping to keep everything as it, or, what they had. I think you're probably good, Andrew.
All right.
Thank you.
Thank you, Randy.
We do.
Consent agenda?
Minutes. The reporter's monthly report, which Jayne referenced earlier, and the auditor's quarterly report.
I'd move to approve the consent agenda.
Second. Motion and second to approve the consent agenda. Is there any further discussion? All those in favor, say aye.
Aye.
Those opposed, same sign. Motion carries unanimous. There's some questions that were up there earlier.
No,
Oh.
that was from previous days.
I move to adjourn.
Wait.
Just a second. Committee report?
Oh.
No committee reports?
Wait, on Wednesday, there is a meet and greet at Impact Coffee from 5 to 6:30. You gonna be there, Dan?
Do not know.
You don't know yet.
We don't discuss politics at the table, sure.
For Board of Supervisors,
This is to meet and greet for,
for any candidate that's running.
that's, we
including
don't discuss, we
supervisors.
don't bring politics to the table.
It's for everybody, it's nonpartisan. And then the second question I had was, are we gonna go over community services building updates?
That's what I was just gonna ask.
The only update that I have from Halverson is that the sprinkler company will come back to fit out the drops through the ceiling tile. And we're waiting for the date.
It's probably beneficial.
Minor, yeah, it's a flex head and they had to come back after the T-bar grid was reinstalled. So
Have we heard any more what with DHS? I mean, last we heard it, they were on board, but they were pushing it back to their IT people,
Yeah.
so we're just waiting on that yet.
So public health's not gonna move into it. We don't know about DHS yet, and we're gonna be paying rent at Smith Building for public health. How does that all monetarily work out? Are we still okay?
Well,
The
if
rent coming in?
DHS ain't gonna move in there, then what we're put public out. I mean, if they are not going to, they're backing out, then we'll forward with.
I'm fairly confident DHS will move in.
Just a matter of time.
It's one of those state things, you know,
yeah, well,
what should take a week is gonna take 6 months.
they're slow to action, so we have a boiler inspection scheduled for about a week from now. So that's taken care of.
How much room will be unused if DHS goes in? Will there still be some empty space available for rent?
It's the possibility, 1, maybe 2, but the most just depends upon, what they come up with.
There's a lot of things.
It'd just be-
Just on,
Just be a small room for one off.
What did you say?
Just be one, maybe 1 or 2
office spaces.
Yeah.
Would probably
then-
be the office spaces right next to the lunchroom.
Mhm.
The one
Coming off that.
Is there-
the door.
But then that ain't handicap accessible, that access either. So you got to
Well,
go.
that's Yeah, but you could put, they've got access through,
Well, then you're gonna have, the DHS has got that front part, then you're gonna have to put a hallway down and then it just
well,
make
we
it.
have to put a hallway to the
No.
lunchroom. How do
No.
we get to the lunchroom from that? front
The others
side?
get from the backside. You can come from lunchroom from both sides.
From the Spectrum side, you can
Yeah.
get to the
And
lunchroom.
usually the Spectrum side does not want anybody going through there.
Well, that's the
That would
only
just
one.
be-
There would be just them going to the lunchroom. Otherwise, the DHS people would go on their side. Just keep that.
Twice go around, how,
They don't. They're only there from 4:30 to 7 or something.
Well, with the handicap accessibility being the issue.
And when Spectrum is done, when toys go around, they're in there. So their Spectrum people are all gone. When toys go around, are in there doing theirs.
So they can, Toys R Us can go through this with Spectrum.
Yeah, they go to the Spectrum space if they want to go, because they utilize kind of, I think there's some of the people work or clean toys.
The only thing that would really have to change, DHS takes that, is then we have to put an access door to Spectrum's office space that goes directly into the Spectrum side. And then, use. Only no one would be walking through the DHS area.
So our two offices, corner offices back there,
If DHS didn't use them, then I mean. whoever
yeah, they
wanted.
haven't planned on using it to this point.
Yeah, but you have to be careful who goes in them too, because that entryway in there is not handicap accessible. That's.
You would probably have to give that space to DHS. If you wanted a couple office spaces, you could take some right off to the right on the main entry. You know,
Yeah.
to where that bathroom.
That
door
would
there.
work too.
That- You could get some there and then you'd have handicap accessibility on both sides. Because you have the other door that goes into the DHS side.
That would
So
work.
DHS goes in. If that happens, is there not room for public health then? In the building?
Well,
There may be room, my understanding is there may be room, but they need so much remodeling done before they would utilize it that we want to make sure that it's.
and it's hard to put floor, you can't put floor drains, you can't put water to get to utilize for their foot bath is foot clinic, you can't, it's just hard to put plumbing in and a cement floor, I mean,
Yeah.
it's just hard. You have to utilize the
Not saying it can't be done.
but
But
it
it's
would
gonna
be.
cost.
It's
Well,
it's cost.
but if we're paying how much per month to be at the other building, so
So,
that
yeah,
you can
it would
bust out a lot of
be,
concrete, put in drains.
well, you ain't gonna bust.
It's pretty
You're gonna
expensive.
go and start jackhammering, you're
Plumbing
gonna.
changes and all.
What are we paying a month for renting in Smith Building?
3,000.
3,000 a month. So it's good.
Doesn't go
So
very far in construction work.
$35,000, that's 1 year rent. What we're paying. So why don't you remodel the floor?
We have, you're not gonna remodel the number of, they're talking, you heard her comments today, we don't have enough hand sinks, we don't have enough,
Yeah,
all of those
you
issues.
can't, there's just no
That
way.
becomes
you
a
could-
lot of plumbing.
Well, it's one long trough over to the,
Then it's, yeah, you gotta look the whole situation over.
that's,
You'd be,
You probably have to, go back to the blueprints for the building to see.
If
where
we
the
get-
plumbing is installed underneath and.
yeah,
where
you
utilities
just
are.
start tearing the floor up and knocking stuff.
You definitely.
The biggest thing is if DHS moves in there, we get rid of that building, we've gotten rid of. We're down to one building instead of two. Even though if we're paying some rent, we're still way money
yeah,
ahead.
but it's not some
We're
rent.
way money ahead.
It's not some rent, it's a lot of rent.
No, but we're still way money ahead. If we get DHS in there, get rid of that building, we're down to one building with hardly no maintenance. The maintenance up on the Smith building is what it is, yeah, even though we gotta pay rent, we're still way, way ahead of the game. I mean, if you stop and think about it, put it on paper. If you look at it on paper, we're way money ahead doing
And I think we'd be way money ahead if we wanted to move them down there to bust up the floor and get the drains in the way we
You
want.
don't,
I think we'd be biting into a pretty good sized construction project.
Well, it doesn't hurt to get an estimate. If we get to
Well,
that
we-
point.
Maybe
Right.
we
How
should-
about we,
But I,
first decide what DHF is
You
gonna
gotta see
do.
it there.
And then-
If they ain't going in there, then we,
Especially if ever the food pantry
Pantry.
or the toys go around decide to leave.
Yeah.
And you have more space, then you for sure at that point need to look
if,
into.
if toys go around, there's water excess out there where that'd be huge. That would, that cost would be, all you'd have to put in is office space. Then you got the water area out there where toys go around it's bathrooms and water and it'd just be astronomical there. And they'd have their own entrance to public health. Yeah, that would
question,
be huge.
you mentioned putting it on paper. It would be great for the community to have it on paper so that we can say, yes, here's the savings, here's what we're doing and why it makes sense. Would you be willing to do that, Mark?
I can do that.
Great,
Represent,
thank you.
put that down.
All right, we have a motion for adjournment.
And a second.
Second. All those in favor, say aye.
Aye. But I ain't gonna do that until after we get rid of the Smith building at DHS meeting. Then, yeah. Show it till that happens. It's.
Yeah, you and I knew exactly what big reference when he brought that up, but. Yeah.
People that can't.
Hey, neighbor. Neighbor.
Hi, neighbor. I was gonna say that when I saw you first. Paper long ago. We haven't gone anywhere.
In fact, he's both lawn.
Yes, he did. That's a really good.
Yeah.
And thank you for what you're doing here, all of you. Good to see you.
Wheels in motion.
When they go back to the Smith building, I mean, I've gone through most of that place. And it's still, that's what it's about to take care of it, like, to be able to involve on the side of the house. Go down and.
I haven't turned off the, it was really easy, guys.
Records.
All right, I'm gonna close the meeting down. There are only two of us in the room. Thank you for attending.
Shrubbery.